C. diff symptoms can fool you. They vary from person to person, and diagnosis is tricky because they can mimic other illnesses. In this video, you'll learn about the most common C. difficile symptoms and what's actually causing them, plus the number one thing most people get wrong when it comes to diagnosing this infection. C. difficile is a bacteria that can cause gut infections, and those infections can range from mild to very severe forms of diarrhea or intestinal inflammation. C. difficile infections often start after taking antibiotics or if you've been in a recent hospital stay or stay at a nursing home. So it's important to note when it comes to symptoms, you don't need to have all of the symptoms. One can just have a couple of the symptoms, or a person can have a lot of the symptoms, and the infection can range from quite mild to more severe. I will put some links in the description below to the health authority sites that refer to the symptoms if you'd like to look into them more. So the most common symptoms for a mild infection would be a mild diarrhea. It could be an unexplained or new onset diarrhea or watery diarrhea 3 or more times a day for at least 1 day. There can be a foul smell that comes with the diarrhea, but that on its own is not diagnostic or proof of C. difficile. You can have mild stomach tenderness or stomach cramping. Now, more moderate or severe infections, the more common symptoms would be watery diarrhea 10 or 15 times a day, usually with a foul smell. And these more moderate or severe infections are more common with the elderly or older people over 65. Nausea or loss of appetite, abdominal pain. There may also be a fever, fatigue, or dehydration from the excessive diarrhea. There also can be blood or mucus or pus in the stool, and that's because of the infection. The colon can form patches of raw tissue that can bleed or make pus. And some folks will also have weight loss because of all of the diarrhea for long periods of time. And severe infections, which are less common, can include a very swollen, inflamed intestine. Sometimes that goes into the toxic megacolon. Sometimes surgery is required, sepsis in the blood, or holes in the intestines, but that fortunately is not as common. Over the years, our clients have shared with us many stories about their experiences dealing with C. difficile infections, and I just wanted to share a few of these stories with you. So Linda said her symptoms of diarrhea, bloating, and achy joints she had after she took antibiotics. Those symptoms lasted for about 4 months. Robin said she was hit with nonstop diarrhea so bad that I was eliminating every 5 to 10 minutes for more than 7 days. She ended up in the ER and she was treated for dehydration. Vicky said, I had gotten to the point of passing blood without a stool, running fever constantly, horribly fatigued, and my skin itched terribly. Deanie said that I had, for several months, bowel incontinence that had become so bad I could almost not leave my house for fear of having sudden, unexpected diarrhea. It was a nightmare. And Lena had a young child. She said, my 3-year-old child had C. diff for about 3 years. He had diarrhea after every meal 3 to 5 times a day. And Kirsten said, I was ill. I had terrible pain in my gut and it was unbearable at times. When I went to the bathroom, I was bleeding out. I knew something was seriously wrong. So that's a few examples of what real people have had to deal with when it comes to C. difficile. And like I said before, some symptoms can be more severe and some more mild, but that's just an example of what some people have had to deal with C. difficile. So, further complicating a diagnosis of C. diff is because there's a lot of other medical conditions that share similar symptoms along with C. difficile. And so I have a slide here that covers some of the more common medical conditions. And you'll notice some overlap here between various conditions and their symptoms. IBS, or irritable bowel syndrome, is pretty common today, and some of the symptoms that correlate to C. diff are diarrhea, cramps, and bloating. But that IBS, you typically don't have a fever or an infection with that. And also irritable bowel disease like Crohn's or ulcerative colitis. Typically there's bloody stools, abdominal pain, and diarrhea. This is an autoimmune disorder and not an infection. A real common cause of diarrhea is actually antibiotic-associated diarrhea or antibiotic-linked diarrhea. And that's diarrhea caused by taking antibiotics. And actually about 10 to 25% of diarrhea caused by antibiotics is actually C. difficile. And as you can see, there's also food poisoning if you eat something that is contaminated with bacteria or toxins. You can get sudden diarrhea, nausea, but that's usually a pretty short-term sickness that you would have. And of course, stomach flu, that's typically viral, diarrhea and vomiting. And that's viral disease, not caused by a bacteria like C. difficile. And there's even microscopic colitis, which is not as common, and even food intolerances like lactose intolerance that can cause gas and diarrhea after you eat food, but that's going to be, again, caused by foods that have lactose in them. So it's important to bring up these other medical conditions and to know what else can mimic a C. difficile infection, because symptoms alone can often lead to a misdiagnosis if that's all you're looking at. So the more you understand about the possibilities, the better off and the better your chances will be of getting the right care. So now that you know a little bit more about C. diff and the symptoms that it can create, what actually causes the symptoms of C. difficile? Well, it's not actually the bacteria themselves like you might think. When C. diff are actively growing and causing an infection, they produce two kinds of toxins, a toxin A and a toxin B. And these toxins are very poisonous. They're very irritating in the colon, and those toxins attack the lining of the large intestine. They kill the cells, they cause a lot of damage, and then the colon, the large intestine, gets inflamed. It gets leaky, and that's what causes the watery diarrhea or the diarrhea. It's all that inflammation caused by those toxins. And there is such a thing as toxin binders that actually go into the GI system, and they can grab up those toxins so they can't do as much damage, and that can help your colon heal up, and it'll help you feel better faster. And if you're interested in learning more about a particular toxin binder that I like, check out the links in the description below. The number one thing you need to remember is you can't diagnose a C. difficile infection based on symptoms alone. There's actually three parts to a proper diagnosis. One is symptoms. So first of all, you want to meet with your doctor so they can perform a symptom evaluation on you. I do recommend, if you can find an infectious disease doctor or a GI specialist, they'll be a lot more familiar when it comes to C. difficile symptoms. The second part you'll want to cover with your doctor is a risk assessment. They'll want to look at your recent medical history, if there's any risk factors that you have that could contribute potentially to a C. difficile infection. And then the last very important piece when it comes to a proper diagnosis is having your doctor get you the right C. difficile tests. There are tests that look for C. diff, and there's toxin tests, and you want to make sure they get you the proper test. Getting the right tests and understanding what they actually mean will help you get the right treatment and will help you feel better faster. Check out this video to learn about the most common testing mistakes and find out the very best test to discover if you have an active C. diff infection.